Welcome. Let's talk about trust, data, and the spirit of social license in healthcare. Social license refers to the informal approval granted by society that allows an organisation or professional to operate in ways they may extend beyond formal regulations or typical social boundaries. For example, when a patient consents to a doctor listening to their heart, they are not only permitting a clinical action, but also expressing trust in the practitioner's role, an act grounded in social license.
An aspect of health social license extends to the sharing and secondary use of health data, where public trust plays a critical role in practices that are not always visible or well understood. Health data is increasing use for a range of secondary purposes that extend beyond direct patient care to clinical research, service planning, and policy development. This is an important consideration in this digital age when health data has expanded into artificial intelligence development.
Despite its growing utility, many individuals remain unaware of how their personal health information is collected, shared, and protected. This disconnect poses a challenge to maintaining social license, which depends not only on legal compliance but also on transparency, accountability, and alignment with community values. We have a clear example of the loss of social license in the UK's Care.Data initiative. Intended to improve health services through the secondary use of patient data, the program failed due to poor communication, lack of transparency, and public concerns over privacy and consent. Many people were unaware that their data would be shared, leading to widespread distrust and the eventual cancellation of the project.
At QDHeC, we have been exploring social license. We've been undertaking 3 global reviews of willingness to share health data. One study with a focus on the quantitative studies allowed us to complete a meta-analysis showing 70% of the public are willing to share the health data, and that is higher for research endeavors. A scientometric review looked at the insights, frontiers, and path ahead for health data sharing for secondary use, and a qualitative review provided granular and rich contextual information for sharing health data. Finally, a qualitative study with Queensland consumers explored their perspective on AI in healthcare, which were then mapped to the 6 principles of the WHO organization's guidance on ethics and governance of AI.
There are a number of PhD projects which stem from the previous research QDHeC has already undertaken. We are currently exploring several projects that examine the implications of social license in health data use, including its role in research, planning, and development of AI in healthcare. Clear communication builds trust in health data use, but many people still don't know where their data goes. So how do we change that? PhD candidate Quita Olsen is exploring how we talk to the public about the secondary use of health data. Her work aims to co-design a communication framework and tool shaped by real people's preferences to help policymakers and health organisations build trust through transparent, clear communication on health data sharing.
AI is transforming healthcare, but how do we make sure it earns our trust? Right now, we're asking how comfortable is the public with AI in healthcare? What benefits do people see and what concerns do they have? And most importantly, how can we build trust? PhD candidate Dr. Duong is exploring these questions through research focused on public perceptions of AI, especially in the context of the patient-clinician relationship. The PhD project includes real-world clinical examples such as how people interact with AI in diabetes care. By understanding what makes people feel confident and supported, this work aims to strengthen both public comfort and clinician capability as AI becomes a more familiar part of healthcare.
Just like a warm hug, the social license to use health data is built on reciprocity, connection, and trust. A hug is freely given and received. It brings comfort, resilience, and a sense of safety. When people feel informed and included, they're more likely to trust how their health data is used. Trust that drives innovation and better care. Let's build a positive, healthy social license.
One meaningful connection at a time.